What about like running shoes? Because I know that they'll talk about like heel stabilizers.
Yeah. So running shoes are great.
Yeah.
And I do think shoes have come a long way. Sure. Even if you kind of look at the trajectory, Hoka, when they were first like getting big, everyone thought they were honestly so ugly. I don't know if I can say this.
You can say this.
Because they were, the sole was so thick.
The people at Hoka are not watching.
I mean, I love Hoka.
Yeah.
I do recommend them all the time. So they have a really thick sole. People thought that was just so ugly. They have a really big rocker bottom.
Okay.
But the counter, which is I wish I was wearing sneakers, but the back of the shoe is actually really nice and stiff, which does what you're talking about. It helps hold the heel in good position.
Okay.
Shoes alone, though, if you have really flat feet, aren't going to correct it fully. Sure. So that's why an orthotic with the shoe is a great thing for people to have.
I use the Adrenaline Brooks Adrenaline GTS, and they have like a little horseshoe in the back. I was kind of scoffing that they're going to stabilize your heel. I'm like, all right. And I got this and I was like, all right, point proven. I think that I don't know how well, throughout running, it's actually doing that, but it's at least got a little something in there.
It's trying, yeah.
Yeah, a little something in there to do that.
I love Brooks are great too, honestly. Brooks, Hoka.
What's your take on the thick sole?
I really like the thick sole. It depends on what sport you're doing, though. Obviously, if you're doing a lot of like side to side plyos,
no chance.
Thick sole, you're going to sprain your ankle.
Sure. Good for business.
Yeah.
Bad for the person.
Yeah. But running, especially long distance running.
Yeah.
And if you're running on any type of hard surface, like you really do need that cushion.
Yeah.
And a lot of them now are having like a rear foot rocker and the forefoot rocker. So it really helps propel you forward.
Yeah.
Which is more economic for your running.
For sure.
Which is great.
For sure. Okay. I've always been, and now this is starting to come out, like my propensity to be brain first. I've always stayed away from, some of the soles are super thick.
Yes. So in older patients, I always tell them to go to the store and like really walk around in them because some of them, the sole is so thick, they actually trip over it.
Yeah.
And also if you've never run in a really thick sole with a rocker and then you try to run in one, I mean, you're going to fall over. They're very, very hard to get used to if you've never done it before. Okay. So you have to kind of ease your way into it.
Where does proprioception come into this for you?
So also with the thick sole, the cushion kind of shock absorption, you do bounce a little bit.
Yeah.
So I would say that proprioception is a little harder in those shoes.
Yeah.
But again, it's patient preference, and some people absolutely love them. And if you get used to them, your running is amazing in that.
I think the gold standard, at least from like what I hear, is I'm running on clouds. Isn't there a shoe on cloud?
There is, yes.
Right?
Yeah.
I think that is like that's what you want to feel when you're running. But from a proprioceptive standpoint, which is, for anyone who doesn't know, that is just feeling your body move through space, feeling your feet on the ground. Mm-hmm. It's just like internal sensory system. And I always recommend like the kind of mid to low insoles because I'm always trying to get, like, I think that most runners don't run correctly. I would assume that you feel
I see
similarly.
this all the time, yes.
And so like I'm trying to get as much proprioceptive awareness so that we can get any hamstring at all in this running gait. So I've always leaned on lower soles for that.
I mean, that makes sense. It does.
Yeah, I think we're coming at it from a different perspective. Like if I'm talking performance, I like just whatever. Like even those carbon plated ones. Have you seen these?
Yes.
Have you run on those?
I've never run in them, but I have obviously a lot of patients that run in them. Yeah.
Pros, good or no good?
They love them for when they're
speed?
actually racing.
Yeah. Okay.